The IVD is the intervertebral disc. So IVD is short for intervertebral disc. It is made of fibrocartilage, which is very tough. As we talked about back in the tissue lecture, you can get compression fractures from the fibrocartilage toughness. That negative y-axis compression, you hit your butt really hard, the vertebra smashes down on itself. The disc can make that vertebral bone compress into itself. They're that strong. All of the IVDs added up in the spine allow for movement of the spine. They are filled with fluid, mostly water. Okay, this one is very important for disc health. Once hydration of the disc starts to fade, then the disc health starts to fade, and you're going to have a whole slew of problems that come with that. Now, this is in my field. I see a lot of disc injuries and a lot of low back pain and neck pain, and all that is because of disc injuries. And the different treatments that are available, from adjustments to cold laser therapy, electric stem, spinal decompression, dry needling, core strengthening, rehab, soft tissue mobilization, kinesiotaping, ice, heat, Groston, and a variety of other modalities and conservative management treatments can really help these people. That certainly beats doing nothing, and it beats constantly doing medication, cortisone shots, anti-inflammatories, and can help avoid surgery. So, hydration and disc health, spinal health, very important. Don't forget, your spinal cord is inside of that vertebral column, and disc injuries and spine injuries can influence in a negative way your nervous system health, which adds to the ailment. So fluid is lost with these subluxation patterns. I do want you to know that term. Subluxation is a misalignment of the bone. And then when this happens, you're susceptible to herniation, low back pain, stiffness, degeneration, and some other ailments that we'll address and get into later. Okay, I want to talk for a moment on the mechanics of your disc. This is from Bogduk. He's a world-renowned researcher with spinal biomechanics and disc behavior and all that. Okay, so some things to know. Number one is the outer rings to the disc are called the annular fibers, and they are made of collagen fiber rings, and they, if you look closely here, they wrap themselves uniquely around and around and around, orienting themselves in oblique and transverse fashions. Collectively, this gives the disc some strength. The middle of the disc is called the Nucleus Pulposus. Okay, the middle of the disc is the Nucleus Pulposus, and that is where you find the proteoglycans. That is where you find the fluid and the disc health. Okay, all that is found within the Nucleus Pulposus there. Also, the nucleus is what herniates. Now, we'll talk about herniations later, but a herniation is an injury to the Nucleus Pulposus, and the material that's inside will go, typically it goes posterior and lateral. Okay, so we'll get into that later on. Also, know that in this picture here, so we'll just call this one number 1 and this one number 2, know that throughout the day, because of gravity and pressure and the weight of our bodies and all that, the disc does collapse a little bit. It's like taking a jelly donut, putting it on a table, and pushing down on the top. Pushing slowly, don't damage it, just push slowly, and you'll notice it just starts to shrink in height. That's a natural phenomenon that happens to us throughout the day. And then when you sleep at night, in that recumbent position, the discs reinflate, so to speak. They get larger. That's what number 2 is showing there. Also, movement throughout the day can help pump fluid in and get the disc hydrated and inflated again. And the longer you sit without movement, the more this one takes place, the number 1 diagram there. Okay. So that means if a person has disc degenerative disease, or they have a herniation or some sort of disc and vertebra problem because of that phenomenon, it can get worse by the end of the day. Okay, in this picture, this is a lateral view of the lumbar spine. So there's the lumbar bones, and this is the posterior aspect, this is the anterior aspect. There's sacrum there. Okay, so we're seeing L5, L4, L3, L2, and L1. And then this space in here, those are the disc spaces, okay? And also look closely. You're going to notice that there's some damage to this disc. Okay, it looks like there's almost a distinct circle there. That's called a Schmorl's node. That's evidence of a compression fracture.